More analysis on Professor Karim's revelations at that public meeting yesterday. Let's chat now to Parliament's Health Portfolio Committee Chair, Dr. Sibongiseni Dhlomo. Dr. Dhlomo, good morning and thanks so much for your time. A lot of people this morning feeling, as my partner said earlier, feeling very proud of the work we see being done by our doctors and scientists, and also feeling a little more optimistic, I suppose. What's your take on what you heard last night?
Good morning and good morning to our viewers. It was so heartwarming listening to the presentation made by the Professor Abdool Karim Slim. By the way, he's almost a world expert on epidemiology, on HIV and all such programs. So it's very comforting because whatever decision that our government will take will be based on this advice scientifically arrived at. But the best thing that I could remember from what he told me was that it's not so much about the behavior of the virus that's going to determine our positive outcome. It is a behavior of all of us as South African citizens.
And I think that is vital. And like we've been saying, the coming week is going to be critical for us to decide, for government to decide how they are going to deal with this going ahead. Also with people wondering now whether the extra 2 weeks will be enough. Will we see another extension? What would be, for you, the most critical thing in this critical week that needs to happen? In terms of testing, in terms of people complying with the lockdown regulations, etc.?
I think the key three things I would like to see is that we respect what actually has been put down as the protocols for lockdown protocols, respect them all as they are. Number two, Professor Abdool Karim Slim is saying something unprecedented in the world, where we're not waiting for South Africans to be ill and come and cough or sneeze, but we are actually saying we are going out now on a massive screening and testing, unparalleled in the world on the COVID-19. So we think that is going to actually assist us in the next coming 2 weeks, because it's going to maybe make us to lock down those that we find. We are going to make a dead end to whoever we find as being symptomatic, and therefore quarantine or treat them there, and that's going to be actually very important. What also is important for us is to watch the space in terms of, are we able to flatten the graph in terms of new infections into the pool, and that is something that they were actually putting a graph and some points on it as to what would be the most acceptable level. So those three things to watch for me, and the whole 9 points that he really raised there would be key in terms of us turning the tide in this pandemic.
Now, of particular concern, Dr. Dhlomo, are things like what we see happening over the past couple of days, what you know has been happening in areas like Alexandra, what we showed you in Mitchell's Plain, people going out, expecting food parcels, talking about hunger, talking about how they can't make it from day to day without food. We saw people queuing at clinics. We saw very little control there. What we see happening with the doctor in one province now, there's a race against time to find those that he's come into contact with. What we saw happening at St. Augustine's last week as well. So how do we navigate those things? Because these are big things that could change the picture entirely.
Yes, ma'am, you'd realize that navigating through this process is not going to be easy. Like I'm saying, some of our success stories are things that other countries envy. It was very regrettable that some of the countries lost out on the 2-week period, and we started much earlier, and we are here where we are. But we are right, it's not without challenges of people not able to access food and actually access areas where they could go in and get some of the things that, even to access work. But yes, the sacrifice that we make is probably worth the while in terms of the problems that we face. I do not have answers to all what we are saying, but I have all the hope that when we are actually going to be scientifically guided by the report and the presentation of Abdool Karim Slim, our country, our leadership will take a good judgment as to when they could actually begin to relax the lockdown in the light of, yes, the stresses and the frustrations that you actually are putting out there that some of our people are feeling.
And I think, a lot of the concern out there is, yes, if we don't go beyond the end of April with this lockdown, the harder work begins then, don't you think, in terms of post-lockdown and what happens then? That's going to be a very, very difficult phase for us.
If you listen to the advice of Professor Abdool Karim Slim, they are saying when that time comes, can we please have it not done abruptly, meaning that there may be certain things that we must start giving into and probably hold back to some of the other issues. I like some of the presentations that he made to say maybe very occasionally, once a month, we need to do surveillance in schools, surveillance in big factories and companies, so that we can make sure that we are really on top of this. What actually is his presentation saying? We will have this COVID-19 even in South Africa. It may actually become a worse infection, but we would have to buy time now so that when we are hitting that level, we are ready and able to deal with the situation, because it probably will come at our shore some other time. We are glad, but with the presentation, because like we were saying, I listened to his presentation. Why do we have in Germany not a big pandemic like in other countries? He gives us answers to those issues. So we can learn a lot from the presentations of these eminent experts.
And Dr. Dhlomo, just one last question for you. What are your main concern or concerns at this point as we navigate the next couple of weeks?
I think what I could actually say is to keep to those key priorities of washing your hands, sanitizing your hands, making sure that we actually cover our nose and with the mask, we sneeze into and cough into a tissue or into our elbow. Those things would really make sure that I can sit with you in the same house and not really infect you, because I am observing the very basics. We stick to those, we would guarantee that we would be able to contain the infection. And I would wish that all South Africans should see it as my responsibility, our collective responsibility, and not just the government and a few other people out there.
Very true. Thank you very much there, Dr. Sibongiseni Dhlomo. And I think